You need to be the brave one in the room and take the decision. And I hope you don't choose to fail. The conversation I'm talking about is the conversation that we must have with our aging parents or with somebody who's terminally ill. How do they want to go when your body is refusing to give up despite the pain and the suffering and the fact that you don't have too many chances on your side? We avoid this conversation because you're scared to have these conversations. I was. We want to avoid these conversations because we feel maybe it's disrespectful for the person. We avoid these conversations also because it is uncomfortable to have these conversations. But the amount of regret and heartbreaking pain they leave you with is something I wish on nobody. When our body is really aged and suffering and dying, I'm talking about my parents, I lost my mother recently, it comes to a point where the doctors have to intervene medically to literally just keep your body alive. Now, when you're young, your body is stronger. The key difference between being young and old is how fast is our body going to heal from a sickness or from an injury. Both those are important words, sickness and injury. And also, when we're younger, our body is able to take a lot more pain than it is able to take when we are aging, right? As you can see with the children, or when we were kids, right? You're falling, you're scraping, you're breaking bones, it happens. But as you grow older, even a slight tough touch or a knock hurts a lot more because our body's tolerance towards pain has gone down a lot because it's aging. To the other two words, add pain tolerance. All these three words really play a difference in how we decide to let our parents go to the other side. I lost my mother recently, and we'd never had this conversation with her and did not have this conversation with the medical doctors. Also, there's this emotional element involved with the patient and the family, which I think a lot of us avoid. Doctors avoid, and so do we, because these are hard conversations. So when the body is not giving up and the person is getting into distress, they are aging, they are suffering, there are two medical interventions that the doctors can use. There's a CPR, where they press upon the chest to massage the heart to continue pumping. And second intervention is the ventilator, where they introduce a tube into your breathing, into your trachea, so that the breathing is maintained. The person is able to live and breathe. When you read about them online or you Google it, it's put very, very politely. The body, the heart area is massaged, the heart is massaged into action again. But what we don't know is then when CPR is applied, there are chances that it can damage your ribs and in fact even break your ribs, which a younger body is able to take and heal from much faster because the pain tolerance is high, healing is high, right? Imagine an 80-year-old healing from a broken rib. Okay. Now, if the patient has only had a heart condition, this might be a great intervention for them because they'll go on to live. But if the body is suffering from a terminal situation, what are we trying to save? Get them what? I don't know if it was worth it. The second intervention is the ventilator. Ventilators keep people alive and save lives. But what if your patient or your parent is terminally ill, is suffering so much that the body is not going to be able to recoup? You're just buying a few hours. What is the cost of those few hours and a few days? The cost is so much of pain, I can't even tell you. Because when you read about it online, it causes oral injuries and might cause internal injuries, because when the tube is pushed, your trachea can feel physical injury, right? And when it's pushed into your mouth, it can give you oral injuries. What do they translate into? Do you even know what it translates into? It translates into sometimes it hurting or collapsing your trachea inside, and it can also translate into broken teeth. To your parents, an aging body, a terminal body, deserve that. I leave that decision to you to decide. My regret is that if I had had this conversation earlier, if I was better informed with the medical fraternity, I would have decided for her to go easily, peacefully, without interventions that cause unimaginable pain, and further damage to the body. If I were to relive this, I would really ask two questions. The first question would be, what is the prognosis after this intervention? And I just want a one word answer, good or bad. If they say bad, that means the chances are really, really slim, because remember, your patient is already old and is suffering. If they say good, then you might want to say yes to that intervention. The second question could be, after you do this intervention, will the patient have high chances to live or low chances to live? Just two words, high or low. If it is low, in my understanding, it's just not worth the trauma that you're going to cause to your aging, sick parent. And I think it's important to push the doctors for choosing one of those two words, because the doctors are also split. Remember, they are trained to make a body live. And sometimes a lot of them are just not comfortable giving you the truth, as it were, because miracles do happen. But that is the tricky thing about miracles, right? We all want to believe that it will not happen. Your parent will not die, will be able to come out of the sickness, right? A miracle might happen. And that is the time to step out of it and just think of your parent suffering and saying, it's time to let them go. It's time to release them. Miracles do happen, but the chances of miracles slim down a lot when our loved ones are suffering from terminal diseases or from a health situation which is got a really bleak or very small chances of revival or them ever being healthy again. It requires for us to be very, very brave to have these conversations when there's still time to discuss these things. My regret is that I never had this conversation with my mother, and I did not have the chance to have this conversation with the medical team. My dearest friend, Sita, who's been my friend for almost 30 years, her mother was suffering from Parkinson's, which was really, really debilitating to her mother. But when they wheeled her in to the hospital when she was really, really sick, had the opportunity to talk to the doctors, and she was very clear that she will choose DNR. Do not resuscitate. Basically, CPR and ventilators are used to resuscitate the patient. But when your parent is so old, so weak, and so sick, the cost of the resuscitation is even more painful in some cases. So it's a brave decision to take a step back and really, really decide what is the best for your loved one. Not for you emotionally, but for your loved one. I told my kids, however bad it gets, whenever it gets bad, I am choosing DNR. I don't want my children to go through seeing me suffer like this, and I don't want to suffer it either. You see, doctors are trained to fight. They're trained to save life, to protect life. But there's this emotional element that only you can feel at that time. So you need to be the brave one in the room and take the decision from the perspective of your loved one, not you. I know exactly how I'm going to handle the passing away of every elder in my family. It's going to be as peaceful as we can make it. I think it's a conversation that mature adults should have, a conversation about how would you like to be treated towards the end of life. Would you want medical interventions or would you want a DNR? It's their choice that you get to respect instead of living with regret.